Okay, we will start. Let's see. Before that, I want to show one picture here. Can you notice from this slide? What is this? From the pictures, can you see? Yes?
Eardrum. Eardrum.
Yes, very good. This is the eardrum, and the middle ear, how it's located inside the skull. Okay? Can you see the nerve? The two nerve, the vestibulocochlear and the facial nerve also you can see. Okay? And the eardrum are protected by the three bones. One is meatus, flat and incus. These three bones are protected. Sorry, steps. Okay? Mist, that is, these three bones are protected our eardrum. That's why we can hear. But the air, the sound wave can flow into the ear canal and enter into the eardrum. And these eardrum are protected by these three bones. And today we will discuss about the middle ear infections, but not only the otitis media, rather than other diagnoses. Let's see one by one. I'll try to cover up two topics today. And let's see the introduction. The middle ear disease is characterized by an inflammation of the mucosal lining of the mastoid antrum and the mastoid ear cell system inside the mastoid process. This is the mastoid process. Okay, you can see. And these mastoid processes are in the mastoid bone. It's covered with our ear. And how it's infected, you can see from the structure. As a result of the infections, you can see the diagram, that extend to the ear cell of the skull behind the ear. Because of the infections are extended inside the middle ear, the bone are infected and decalcify. The mastoid process is the portions of the temporal bone of the skull that is behind the ear. The mastoid process contains open and air containing space. In between this, the problems are arise because of the bone are infected. Okay? Are you clear? Yes? Yes or no?
Yes, ma'am.
And the acute mastoiditis. What is acute mastoiditis? We will see the definition. First you see the infections, how the inflammation is occurred behind the ear. Okay? That is inside the skull are infected, can even see from the outside of the ear. The incidence of the acute mastoiditis are 1.2 to 6.5 are the incidence per 1000 per population, but it can be treated if we are not neglected. Okay? And the definition of the acute mastoiditis, it's already we got the concept from the introduction part. It is the inflammation of the mucosal lining of the antrum and the mastoid ear cell system. See the mastoid process, you can see this is the mastoid process, and the middle ear, how it's located inside the skull. Okay, and this is the cholesteatoma. Cholesteatoma is the collection of the keratinized cells inside the mastoid cell, and that is just like a growth type. Okay, so decalcify. Because of these bone infections can be entered and affected into the eardrum or can be lead into inside the bone. Okay. The next slide. The etiology of the acute mastoiditis is the age. The age factors mainly affected in the young age. Then socioeconomic group. And the socioeconomic group, what do we understand here? That people have suffering from these kinds of disease and they are ignoring and just taking it easily because of they are not highly educated and the low socioeconomic status. They have the poor and they always deny. Then it's further spread inside the ear and it's totally infected. and it's required for the surgery. Then the organism virulence because of the not maintaining the hygiene, or maybe they are putting some stick inside the ear trying to take out ear wax or something. Then immunocompromise because of low immune. Then cholestoma can be occur. Just I have shown you the cholestoma. It's how it's affected in the ear. The pathophysiology, production of pus under the tensions means because of the infections, and the purulent infection can be occur inside the ear and the bone are infected. And it can be, discharge, ear discharge can be happen. And the hyperemic calcification, and there is an increase of blood circulations, highly blood circulated, as well as decalcification inside the bone. That means the bone are not reabsorbing and totally decalcify. And you can see from the third point, the osteoclastic absorptions of the bony walls. Osteoclastic is the nature of multinucleated cells. These multinucleated cells are contains lysosome and mitochondria, and these are the action of reabsorption of the bone, and this is already degenerated. Okay, because of that, the bone can be fragment, means that is small pieces can be break down inside the air. Okay, are you getting me? Yes? Yes?
Yes, ma'am. Yes, ma'am.
Next slide, the routes of spread. How it spread inside the ear. Direct bone erosions, then the venous thrombophlebitis, petrosquamous sutures, oval or the round window, that means totally in the middle ear can be infected. Okay, the internal auditory meters also can be infected. So in the first case, if we are not treated well, if we don't take care, or if we are neglected, it will be harm and can be infected, and infected all over the organ which is entering into. Excuse me. Rumi, I class lang ako. Kali mo si kamatang. Internal auditory. So these are the all internal. The middle ear can be infected. Okay. And the clinical features. What are the symptoms? Signs and the symptoms can be occur when the persons are suffering from mastoiditis. Okay, the symptoms are we can find from the patient's ear ache, then the fever can be arise, then the ear discharge will be there. And the sign, the mastoid tenderness, we can find from the examination, sagging of the posterior superior mitral wall and tympanic membrane perforations, and swelling over the mastoid and the hearing loss can be occur. You have seen from the earlier, the previous slide, how the mastoiditis can seen from the child, that structure. I hope you understand. Next, you can see the slide, how what is happening here. Okay, so this is the structure you can see and how the sign is coming. The next is investigation. What are the investigation protocol can be done? Those who are suffering from the mastoiditis patients, first is the blood test. We want to see the erythrocyte level, then the X-ray, mastoid, how much it's affected. You can see in this X-ray how it's affected the bone, okay? And the CT scan, temporal bone, we can examine, or else we can do MRI, either or. If the CT scans are not cannot read properly, then we can go for the MRI. Then the ear swab for the culture we can send, then as well as the discharge fluid we can take for the fluid culture, and then we can do the hearing test, that is audiometric test. From there we can find out how much are affected even in the hearing. Then the differential diagnosis, suppurations of the mastoid lymph node and furunculosis of meatus and infected sebaceous cyst. Even this furunculosis of meatus It's also entered the microorganism and infected inside the air, in the bone. Okay, these are the differential diagnosis, and this 1, 2, 3 point also have been included in the nursing in the diagnosis. The treatment, what are the treatment modality rather than that investigation part? This is the medical treatment, pharmacological treatment, we can say. First of all, when the patients are hospitalized according to the severity condition, may be mild or more severe, mild, moderate or severe. So we need to hospitalize the patients to continue the antibiotic as well analgesic to prevent from the further complications. Okay, then the surgical treatment, meningotomy and the corticomastoidectomy we can do. Meningotomy is also just make the hole and drain out what is the infected disease are accumulated inside the ear. And the cortical mastoidectomy, it's a removal of that the part. Okay, the mastoidectomy are different types are there. Okay, so for this one we are necessary to the cortical mastoidectomy if the meningotomy is failed. The complications of mastoiditis, subperiosteal abscess, laminitis, then the facial paralysis and petrositis, extradural abscess, subdural abscess, meningitis, brain abscess, lateral sinus thrombophlebitis, and otitic hydrocephalus. Those are the complications. Okay, that means it's very related with the subdural and the extradural abscess patients. Why it's abscess? Because of infected entered through the air. Okay, even in the meningitis also. Understand? Yes.
Yes, ma'am.
The post-auricular abscess. You can see the post-auricular abscess, zygomatic abscess, and basal abscess. How it's occur, or you can see from the slide what are the structure it's present when the persons are getting complication on this disease condition. See the post-auricular abscess. These are the very commonest and present behind the ear, and pinna push forward and the downwards. You can see the structure here. Can you see?
Yes, ma'am.
This is the post-auricular abscess. What is the post-auricular abscess? The complication of mastoiditis. And this is the zygomatic abscess. The pus extended entirely to the zygomatic process, facials and eyelid swelling. I hope that some of you have seen from some patients, or you did not see at all. Yes? In the OPD, you have seen any patients suffering from the mastoiditis? Okay, next is the Bijol's abscess. See, can you see the Bijol's abscess? In the child, the ear is how it's forming. Okay, so we can do the meningotomy or the mastoidectomy on all these cases. Okay, up to here is the mastoiditis. Any questions? Actually, this is a very common, very common. The child used to take some stick or somewhere just falling from the floor and pick up and pushing, and then others just in the dirty cloth. Then the people or the parents or the elder people are trying to take out the wax or something. Then it's infected. Then the discharge started, or maybe sometimes the person doesn't have the sign and symptom and having this part, I mean these kinds of the situation, but they are neglected. Since it's neglected, it's entered into the middle layer and infected into the bone. So this is totally for the mastoid bone, infected to the mastoid bone, not to the tympanic membrane, but because of the mastoid infected can lead to the middle ear, even can be infected to the tympanic membrane, the round window. Okay, then all the these incus, plate and meters Sorry, what is that? Another bone. Remember that tree bone which is protected to the tympanic membrane? All together the three bones are called, what is that name? Ossicle. Okay? Are you getting me? Yes or no?
Yes, ma'am.
But can you tell me that the tree
Yes,
bone?
ma'am.
Tree bone?
Hello, ma'am. Malleus, incus, and stapes.
Yes. Miles. That Miles, I used to forget, Incus and plate. The MIS, M-I-S, I used to learn that one. Okay, the next class. What is the time now? How many minutes gone? Only half an hour. We'll go to another slide. Okay, I already have shown the earlier.
11:25, ma'am.
So this one is clear. The next slide I will show tympanic membrane perforation. This also can be happen inside the middle ear. This is mainly infected to the tympanic membrane. Okay, that's why it's called tympanic membrane perforation because of the infections. And how it does looks like this one inside or tympanic membrane. See the right tympanic membrane, eardrum viewed through the speculum. When we see, you have seen in the OPD that some doctors are examining the ear through the speculum. Yes or no?
Yes,
Yes.
ma'am.
So, tympanic membrane perforation. What is the etiology of tympanic membrane perforation? We'll see. One is the direct force and second is the indirect force. So under the direct force are the number one is the careless while removal wax by himself or herself. Okay? Then the skull fractures may be tear tympanic membrane or hot slave fly into the ear. Sometimes, while doing gardening or maybe the night time, if we just lie down in somewhere, then the insect used to enter. Here, just I would like to highlight that if air, the some like insect is enter into the air, we should not put anything. Just leave it. It should die because if we are putting something water or the oil, that will be absorbed and the fly will be swollen. Because of the swollen, it will be blocked and it will be more infectious. Okay? So this is the we should prevent from this one. I myself got last time that is one insect, the one of my friend. That is during the duty hours time only, and we are so scared and she's trying to do syringing and I also willing that okay we'll do syringing and otherwise the insect is trying to struggling inside like then with the normal syringe we just push water. After that, after 2-3 hours, instead of coming out the insect and insect already died and it's becoming full swelling. That's why I couldn't hear anymore and totally full dull. Later on we went to the ENT OPD and they just removed the insect. See, that is accidentally it's happening. Then comes to the indirect force, increase in the violence or the firearm or the barotrauma. Barotrauma also one type of infections, okay? And these are the two, direct and indirect force. Force are the etiology of tympanic membrane perforation. The associated complication, what are the complications of tympanic membrane perforation is usually associated with tympanic membrane or the inner ear trauma unless laterogenic. ossicular discontinuity, facial nerve injury, chorda tympani nerve injury, and barotrauma to step foot plate. You already have seen from the structure. I hope this all the names, whatever listed here will be understand. I hope you will not have any confusion from this associated complication. Yes or no? Yes? Yes. Manase?
Yes, ma'am.
Okay. Then we will go to the next slide, the clinical manifestation. Those who are suffering from this kind of disease condition can be occur otalgia, that is the ear ache, then bleeding can be occur, fullness of the ear, then hearing loss. Hearing loss may be conductive hearing loss or the mixed hearing loss. This can be treatable, and then tinnitus can be present, and the shape of perforation is split. Okay? Then the physical examination. Under the physical examination, we can examine the tympanic perforations, how it's perforated, central perforation or the marginal perforation. Then the blood crust, that is clots, some are present inside the ear, or if the skull base fracture is occurring with the CSF leakage, clear fluid is observed. So like some people are getting trauma, the head injury, the skulls are, either skull fractures, because of the skull fractures, epidural or the subdural or the arachnoid hematoma can be occur. Then the cerebrospinal fluid also can be leaked into the air. So we need to examine the patients whether the cerebrospinal fluid also are leaking or not. We can see the clear fluid if it's present. Okay? The diagnosis, otoscopic examination, the odometer can be provide useful information. Conductive hearing loss is greater than 40 decibel, and then suspiconforce ossicular discontinuity. Then hearing test reveals the sensory neural hearing loss. It means the inner ear injury. What do you understand difference between the conductive hearing loss and sensory neural hearing loss? Can you tell me, Iba? Yes? Chenogi? Conductive hearing loss and the sensory neural hearing loss. Sensory neural hearing loss is the permanent loss. We could not hear anymore. But conductive hearing loss, it can be repaired, means it can be treatable. Okay? Yes or no? Can you hear me?
Yes, ma'am.
Yes, ma'am.
Conductive hearing loss. The loss occurs when the sound is not conducted efficiently through the outer ear canal to the eardrum, tympanic membrane, and the tiny bones ossicles of the middle ear. The sound, whatever the sound wave entered through the ear canal are obstructed. You can see from the this diagram. So the sounds are entered through this ear canal, directly enter into the eardrum. So it is obstructed. Because of that, only the hearing will be lost. So it's called conductive hearing loss. But sensory neural hearing loss is the permanent. It's affected in the cochlea. Okay? So that will be the permanent hearing loss. This is the bone structure. When we are talking about the conductive hearing loss, can be affected in the tympanic membrane as well as this one, medius, incus, and plate. No? This all three together is called ossicle. But once we are talking about sensory neural hearing loss, it's affected in the inner ear. The management. What are the management? What are the treatment modality based on the medical treatment? antibiotic to prevent infections, aseptic external auditory canals with alcohol, then prevent super respiratory infection, then prohibit nasal blow. Okay, then prohibit eardrops, we should not put, and it takes 3 to 4 weeks to heal the eardrum. If 3 months later perforation still exists, then the laryngoplasty is indicated. Understand or not? Can you read from here? Okay, Indrani, can you read from here, from this slide? Management.
Yes, ma'am.
Can you read the slide?
Antibiotic to prevent infection.
Yes.
Management consists of antibiotic to prevent infection, aseptic external auditory canal with alcohol,
That means the
prevent super
cleaning.
respiratory infection, prohibit nasal blow, prohibit ear. It takes 3 to 4 weeks to heal the eardrum. If 3 months later perforation still exists, laryngoplasty is indicated.
Yes. Prohibit nasal blow and eardrop means, you understand, no? We don't. Okay, Indrani, tell me. Prohibit nasal blow and eardrop means? Yes? Yes? Asal say?
We should tell the patient not to blow their nose.
Yes. And not to put the eardrop. Okay, we'll go to the next slide. Prevention. Be cautious while removing your wax and using earplug. Last time also we discussed. Last class was what was the topic of the last class? Anyone?
Infected wax.
Yes, impacted wax. See, those are all related, okay? Infected into the eardrum because of our careless and maybe complicated from some minor procedure being done but neglected by the physician or neglected by the patients. Okay? So there is a two reason behind can be infected in the middle ear. Okay, that was the last slide. Thank you so much. Okay, then let me ask some questions. The tympanic membrane perforation, what are the associated complications? Roll number 1, Alka.
Yes, ma'am.
What are the associated
Ma'am,
complications? Yes.
ma'am, ossicular discontinuity.
Next.
And then
What else?
facial nerve injury.
Yes. Facial nerve injury will be there, pain will be there, it will be weakness, you know. Okay. Then what else?
Yes, ma'am.
Then the chorda barotrauma to the step, that means infected to the bone which is protected to the eardrum. Okay, the ossicles. There is 3 bones, any bone can be infected. So we need to do the grafting again. So we don't want to give chance up to that level. So we are treated with the antibiotics and tell the patient to do the regular treatment and the regular follow-up so that we can prevent from the further complications. Okay? Then we can prevent from all the complications. Okay. Then next is what all are the etiology? Why it's tympanic membrane perforations? What are the etiology? What are the causes? Roll number 2. Yes? What we discussed in the etiology?
Yes, ma'am.
Roll number 2. Yes?
Ma'am,
Ma'am, for etiology, there are two like direct force where if we like while careless, if we are careless while removing the wax, then skull fracture, then all this.
What else? Direct force and indirect force. In the direct force, what all are the complications? Sorry, what all are the causes? Yes. Row number 3.
Ma'am,
Hmm?
ma'am, indirect force, if you are careless while removing the wax, and then and if
Indirect force is what? What we are talking? Direct force means when you are trying to take out the wax. Now, careless while removing the wax by himself or herself. Or direct force means maybe skull fracture, maybe injury. Because of the injury of the skull and the tympanic membrane can be tear. Or else the hot slag fly into the air, it can injure to the tympanic membrane because that are already alive and trying to move inside. Okay, that's why it can make injury. Then the direct force is increase in balance because of assaulted its others and the barotrauma because of the simple infections can be lead to these perforations. Okay, after this one we are going to have one exam. Please be careful, write it down, note properly and all. And what are the clinical manifestation if the persons are suffering from? And please don't confuse in between this one, tympanic membrane perforated and mastoiditis. One is infracted to the bone, another is perforated on tympanic membrane. So what are the clinical manifestation? Yes, roll number 5. Yes,
Yes, ma'am.
yes.
Ma'am, there might be bleeding and hearing loss also. Then shape of the perforation is slit. Then otalgia.
Hmm. What else?
Then
Fullness.
fullness. Yes, ma'am.
You need that. So that means you didn't write down the notes. Hmm? Otalgia, bleeding, fullness, hearing loss, conductive hearing loss, or the mixed hearing loss. Tinnitus and shape of perforation is split. See, you can see in this the pictures. Okay. Okay, I hope all of you clear, no doubt. Then we will stop here. Okay.